2021 continued to make every aspect of how we work challenging, but it also showed that when we work together, we are overcomers and a relentless force for good for our clients and communities. We learned that as a team, we are resilient because we are DHS.
I look back at 21, and I can remember that a year ago, I sat here and said to all of you, my hope was that 2021 would find us returning to normal. And we've had some return to normalcy, but 2021, I think, and I know for all of you, has been a much harder year than any of us anticipated sitting there a year ago. We have really faced a lot as a group together. I am so amazed at how resilient DHS is. I am so amazed at how resilient all of you are. I have again and again through this year been completely blown away by the dedication of the team at DHS and by the way everyone has persevered to keep going. You all really don't understand, I think in many levels, the difference you've made in people's lives by doing the jobs you've done every day over the last year. And I do want to just thank you for it and tell you how proud I am to be part of DHS and this incredible team.
The year started with a great deal of optimism about COVID-19 vaccinations. There was a massive effort by DHS to set up vaccine clinics for all of our facility staff at the State Hospital, Arkansas Health Center, and the Human Development Centers. By early March, all DHS employees were eligible for vaccines, and DHS spent much of the year providing staff with information so they could make an educated choice and protect their health.
It's a team effort all the time here at DHS, and being able to help these people to be able to get their vaccine and to be able to assist them, providing some comfort and understanding and knowledge. And even in situations like this, there's going to be somebody there to literally hold their hand during this process.
We're going to break the rules and we're going to hug. Getting to the point of finding the vaccine for me was like, this is a gift from God.
As we work to get more clients and staff vaccinated, we got the help of some very special friends to spread the word about the importance of this effort.
I'm Coach Sam Pittman, and this is Razorback superfan Kanan Sandy. We're vaccinated and want to encourage everyone to do their part and get the vaccine too. It's safe, easy,
and free.
And it's free.
We were not just focused on the health side of the pandemic. Much of the federal funding and new programs aimed at helping Arkansans weather the economic impact of the pandemic flowed through DHS, with the agency issuing hundreds of millions of dollars in federal relief funds and assistance.
And those were essential people in our community, and we need them in daily life just to keep going, and the state was able to help them by a financial incentive in order to keep them working and help them afford childcare through a tough pandemic.
The Division of Child Care and Early Childhood Education provided financial assistance for childcare for over 14,000 essential workers, including those in healthcare and the food industry. DCCECE also invested tens of millions of dollars to help keep childcare centers safe and improve their quality.
Bye! See you tomorrow!
More help is now available for renters in Arkansas who have lost jobs or are struggling financially as a result of the pandemic.
Over 14,000 Arkansans were able to stay in their homes, avoid eviction, or catch up on past due utility bills because of the rent relief program that the Division of County Operations set up in a matter of weeks.
It was a big step to go to someone and say, hey, I need help.
This effort paid out nearly $60 million by the end of the year in much-needed rent and utility relief.
As DHS opened up the applications for the CARES Act funding that we received to support veterans, We Are the 22 came to our attention, and after meeting with them, we realized what a unique organization this is.
The Division of Aging, Adult, and Behavioral Health Services used $5 million from the federal relief funds to support 30 organizations that provide services for Arkansas veterans, with a focus on providing mental health services for those who needed them most.
And we're very grateful for that funding. We've been able to save a lot of lives with it, and that funding went directly into the field, begin to save lives.
DHS also joined with the Division of Medical Services and the Division of Developmental Disabilities Services, as well as with providers and clients, to develop a plan to use enhanced federal funds to improve home and community-based services in Arkansas. These pandemic-related funds helped support the workforce that helps Arkansans with physical and developmental disabilities stay in their homes and communities. Ensuring DHS had an adequate workforce in 2021 at our own facilities and offices was a real challenge. Today, between 7 and 10% of our needed positions remain unfilled.
All of you who are here, therefore, have really carried heavier loads. And I do want you to know that we all recognize that and that we really are trying to move quickly to hire.
Do you have COVID in the unit? No, ma'am. No, ma'am. Okay.
Office of Long-Term Care Surveyors, meanwhile, continue to focus on infection control in nursing homes, completing more than 700 of those specialized surveys in an effort to keep nursing home residents safe during a global pandemic. Despite the ongoing impacts of COVID-19, DHS continued making our usual work a priority, allowing us to move our systems forward.
We're here to do a job, and that is to make sure that our clients are eligible and that we're giving them the benefits that they're eligible for.
They're not case numbers, those are people, and they're counting on us.
The Division of County Operations moved a step closer to fully implementing its new integrated eligibility system by moving all Medicaid cases to the new system. DCO also launched the pilot for the Supplemental Nutrition Assistance Program. Once complete, it will be the first time that all major eligibility programs have been in the same IT system since 2013.
We're not going to stop working on ARES until the field is absolutely comfortable using it. This is going to be a system that we've always wanted.
Other major technological efforts staff accomplished in 2021 include developing online requests for child and adult maltreatment registry checks, eliminating a backlog of over 10,000 applications in the criminal background unit, continuing efforts to be more transparent by publishing 5 years' worth of psychiatric residential treatment facility documents online, bringing dozens of informational digital bulletin boards online in county offices across the state, replacing the antiquated general ledger system used by the Office of Finance, streamlining the Office of Appeals and Hearings and improving their technology, and finally, making real progress toward replacing the old TR1 system. We also focused on major program changes.
So this is critically important, the filing of SB 410, which is the Our Homes waiver authorization that will allow my administration to go and request a waiver for the expanded Medicaid population and to continue coverage.
The state legislature passed a bill replacing the previous Medicaid expansion program that provides health care to low-income Arkansans. The goal was to create a program that better addresses the root cause of poverty for targeted groups, like new moms and those who were formerly incarcerated. Our Home aims to improve health, not just provide health care coverage.
This day, though, is to focus on 349 foster children in Arkansas who are waiting for adoption for their forever homes.
With help from the Office of Chief Counsel and our partners at Project Zero, the Division of Children and Family Services launched an intensive effort to find children and teens permanent homes. More than 160 children were adopted in just 3 months. DCFS also had to deal with an increase in the overall number of children in care, COVID, and challenges related to placement issues and staffing. But the division also took time to celebrate. Once again, the Foster Parent of the Year Award banquet was a virtual event, with one exception, announcing the statewide winner in person during a surprise reveal that was also broadcast on Facebook Live.
Congratulations, you guys. Y'all are foster parents.
The Division of Youth Services worked to improve the chances of success for youth it interacts with by creating new reentry and intensive in-home services and a new program to address opioid addiction.
Today, I'm announcing a plan to provide services to everyone that is currently on the waiting list.
And we closed out the year with an exciting announcement from Governor Asa Hutchinson that the Division of Developmental Disability Services is moving forward with a plan to eliminate the wait list for waiver services as it stood on December 1st, which will bring life-changing services to families all across the state.
People have waited a very long time. And because of this announcement, we are able now to move quickly to get them the services they need to stay in their home and in the community.
For me, the best thing about DHS has always been the people and being able to see everyone every day and being able to have some fun.
The fun events made 2021 feel a little bit more normal. We hosted the annual Halloween event and DDS Fall Food and Craft Fair at the Central Office Complex. And we never miss a chance for a little healthy competition. Our first chili cook-off had 29 chilies made by department leadership, with bragging rights on the line. But the fun did not stop there. County office staff and facility staff also got in on the action, donning Halloween costumes and hosting holiday events and gatherings across the state, designed to bring a little cheer and lots of smiles.
All of us together really stayed focused on a vision of a future DHS and kept driving towards it. We've seen again and again lots of areas of DHS moving to implement new programs, implement new ways of doing business, and driving to a future and not letting up. And that's really been amazing.